call them back. We're running out of time. Anyone to tell me how lunch was? I know we had a mouthful of lunch. Thank you so much. Please let us take our seats. We begin the afternoon session. Welcome back. Let us get settled. Thank you so much. Let us get settled for our next presentation. For those of us that will need condoms, we have Miss Natasha Mwila giving out free condoms. Feel free. Okay. So, as you know, we have a QR code that we're using to conduct a survey for the youth engagement. Yes, all you have to do is use your phone and open the scan. I'm sure some of your phones have got a scanner. So right there on the wall, you can just scan it there, and then the information will come, and then you fill in according to the question prompts that will be given on the survey. Thank you so much. Welcome back. I hope you had a great lunchtime. Let us get settled for our next presentation. So I know we had a very great morning session. So I'm just going to be asking questions to everyone, no, randomly, to anyone on what their takeaway, anything they heard in the morning session, anything that was impactful, anything that is new. Yeah, I'm going to start from here. Anything that was interesting. Oh, okay. May I please have a sign language interpreter? Okay, so I'd like them to tell me anything that was interesting that they experienced in the morning session. Anything.
Okay, so we enjoyed the morning session. It was great. We listened more about supporting the youth. Yeah.
Okay, interesting. So
There's a hand here.
great.
Thank you. All right. So what was great in the morning session was when we are talking about meaningful youth engagement, let's not also forget about young people with disability and the decision making processes and in our programming. Thank you.
That's amazing. Meaningful youth engagement should not just be involving young people in implementing programs, but in monitoring programs, in planning for programs, in decision making, in consultation, and even in budgeting. As young people, we should be meaningfully engaged and for us to do that, we need to be capacity built in what is being carried out in all the various programming, such as the health program and specifically the HIV programming. Anyone else with a view?
Indeed, Ida, it's encouraging to see the conversations we had in the morning and trying to see what we are going to have this afternoon. But before we start our afternoon session, we are just trying to get feedback from all the young people in the room on how the morning is. I'll pass on the mic randomly to get responses from people. How was the morning?
Good afternoon. How are you? The experience was quite insightful. It was a very good opportunity for me to be in the presence of the Minister of Health. So we are hoping to learn more from this experience, and once we go back, we're going to be the same in our communities because we are willing to learn a number of things, especially that affects a number of youths in our communities and the areas where we're coming from. So we want to come up with solutions that are going to help reduce the spread of HIV and AIDS at a very young level and early teenage pregnancies. So we're working on how we're going to mitigate those factors. Thank you.
Thank you very much. May I request all those sitting behind, can we fill up the chairs in the front row? Atwena sepo mabagi.
Today was a great session. It's not every day you get to see the Minister of Health in Zambia. Every day. No. Today was such a great privilege. And I saw people going to dance with the Minister of Health. RAHi! RAHi! We are indeed Kuchalo. Guys, wait, no, let me not use Nyanja. We were dancing with Roberto. Guys, let me see hands. How many of us have had a privilege, a chance, aside from today, to dance with Roberto? To see Roberto, I see someone there. Guys, muchti. RAHi! Nice. So, guys, we've had lunch. So we need to be very energetic and we need to prepare ourselves to have so much fun, but also learn. And before we can continue our session, I would like to introduce myself. My name is Ida Mlala. I'm from Treatment Advocacy and Literacy Campaign Talk. I am the Youth Hub Coordinator for HIV Prevention and Research. So basically what I do is I look into issues relating to HIV prevention for adolescents and young people who are you and I today. Thank you so much.
Yeah, thank you very much, Ida. And I'm your co-chair or co-presenter today. My name is Maxo Mumba. I'm coming from Sitan Plus, which is Community Initiative for TB, AIDS, and Malaria. I'm the youth coordinator there and the head of youth programs. So me and Ida will take you in today's afternoon session where the real business begins. RAHi! RAHi! Tachoka kuja. I want everyone to stand. Can everyone stand? We have to dance. I need those energies in the room. Can everyone stand? Can everyone stand? Hey. Energize, eh? Gizafunika ka energize, huh? Are we sure? RAHi? RAHi? I need energy. Still not, yeah? Did we eat? Artist Nakute? Takuta? Okay. So, there's this energizer that I always love giving when people are from having lunch. Huh? So with this energizer, it needs a lot of energy. If you can't see me from the behind, you can use the screens to see how the energizer is going. Okay. So, when I say one day, You respond one day, one day. Hey, one day, one day. Now with energy. Hey, one day, one day. One day, one day. My mama say, my mama say, Maxi, cook me some porridge by using your right hand. So whatever I'll be doing, you should be doing, but I'll need energy. Are we together? I'll need what? Energy. RAHi, RAHi. One day, one day. One day, one day. One day, one day. My mama say, Maxi, Maxi, cook me some porridge by using your right hand. One day, one day. One day, one day. My mama say, Maxi, cook me some porridge by using your right leg. One day, one day. One day, one day. My mama say, Maxi, cook me some porridge by using your left leg. One day, one day. One day, one day. My mama say, Maxi, cook me some porridge by using your waist. One day, one day. One day, one day. My mama say, Maxi, save me some porridge. Okay, before we sit,
Okay, before we sit, we're going to do a little bit of dancing, just a few seconds, to shake off the energy and the food that we've eaten. But first, say hi to your neighbor. Guys, greet your neighbor. What's your neighbor's name? Let me ask someone. What's your neighbor's name? Annie, what's your neighbor's name? Annie doesn't know her neighbor's name. Irene, what's your neighbor's name? Natasha, what's your neighbor's name? Guys, ask. I know her name is Titi. Titi. You can go ahead and play the song. Now let's do a little bit of some dancing. I'm not seeing people dance. Ah, la, 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 la. You guys are not dancing. You can. Yes, yes, yes. Ah, la, 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 la. The champion of the lion is Usobo. Champion of the lion is group today. Come in front to come and show them. Yes, come and show them. DJ, one more time. Ay, 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 ay. Ay, la, 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 la. Eh. Ah. Ay, la, 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 la.
Kumbele badala, kumbele.
Lighting the light here. You are next to a window. You are close to a window. Please open the window. Open the window. Open the window that is next to you, or you are next to it. Together, open the window.
I think our energy levels have risen. Hey. Ah. Okay. Good afternoon, guys. Good afternoon, guys. You don't sound like you've eaten. Good afternoon, guys. Okay, I was happy to see some of you, my Sasha and Papa. But mwandishi forever. Muchive mbaturanda twamulisa mvwe tatupwa kusala twamulisa mvwe tatupwa kusala. Na I don't know how to say it in English, but I know what it means. So basically what I'm trying to say is we are enjoying the dancing and this, the jumping, but this is where we carry on with the program. I can see that the energy has been rejuvenated, and this is where we are continuing what is happening today, ladies and gentlemen. It is the Regional Adolescent Health Indaba. RAHi? RAHi? Every time RAHi? Sharp. Okay, so we are moving on with the rest of the program. We are joined by Ida now, who's going to be moderating some of the one of the panel discussions that we have coming up, as well as Maxwell. So at this point, I would like to make a very, very simple and short announcement before I pass the mic on. So the idea is that today, you saw Roberto and Taitu, right? You saw Roberto and Taitu? Okay, so the idea is that we are putting up a challenge for everybody in this room. And this challenge is that where you are seated, from what has been said so far, the presentations made, the speeches delivered, anything you've heard anybody say here that really stood out for you and you feel is a great message, write it down. That is going to be picked up. And what we want to do is, out of the message that is going to be picked as the best message, you are going to take a picture with both Taitu and Roberto so that posters can be made out of those messages. Is that okay?
So stand a chance ya kubako nangu pabana fidia. Mwira, don't be complaining at tata sango pabana. Here's a chance. So the message you're creating is basically, coming up with that. So for now, you are such an amazing and lovely audience. We continue with the program. And this is where I hand it over to Maxwell, who's about to. Oh, in fact, I'm told that there's another reward. Apart from just being on the banner, there's another reward. But that one remains a secret. And as you have seen today, when we say it's a secret, we're not disappointing. The first secret, it was Taitu. Second secret, Roberto. You never know. Third secret, Rihanna. So there's another prize, and that one remains a secret. So I'm encouraging you all to participate wherever you're seated, and the team is going to go around and pick up everything that you're going to write. Right about now, ladies and gentlemen, I give it up to Ida and Max, who are going to continue with the rest of the program. RAHi! RAHi!
Thank you so much, Your Excellence. This is the president of the University of Lusaka. Thank you. So we continue with the program. As it is said, all work and no play makes one a dull girl or boy. So we'll go right into our next session. And for this session, I'm asking all of us to be very attentive, take notes if you can, and then so that you have a chance to ask questions and your questions will be responded to. So our next session is on the need for inclusive programming in the HIV response. The need for inclusive programming in the HIV response. Just to give you a little bit of a highlight about this session, we're basically going to be talking about how can different people of diverse needs and challenges and capacities be fully involved in HIV programming. How can they take part in decision making and planning as an individual or a person that is affected indirectly or directly by HIV? And to call upon, so this one is a panel discussion which will be with young people from key and vulnerable populations. So I'm going to call upon the very first panelist, and this is Dr. Maurice Musheke, the Chief of Party for Checkup Project CIDAS. Dr. Musheke, please come through. A round of applause. Wakanda Kilo. One more time. Wakanda Kilo. Okay, Doc, you can take a seat. Okay, thank you. And I'm going to call upon a representative from the Zambia Deaf Society, a representative or the person that has been given to be part of this panel discussion from the Zambia Deaf Society. A round of applause. The representative from the Zambia Deaf Society. And next, I will call upon a deaf woman who has been assigned to be part of this panel discussion. I'll also call upon a deaf man that has also been assigned to be part of this panel discussion. Okay, so the woman that has been sent from the Deaf Association, so Deaf Society of Zambia, is Bettina Tandiwe Maluma. Bettina Tandiwe Maluma. A round of applause for Bettina as she takes a seat. Then the man that has been, that is the representative for the deaf men, is none other than Moses Soko. A round of applause for Moses Soko. The panelists, I thank you, and I also welcome you to this panel discussion for today, and thank you so much for taking time to be part of this panel discussion. So as young people, as we know, it's very important that each and every one of us is fully and meaningfully involved in HIV programming. That means our decisions and our opinions should be fully taken so that all the interventions are tailored to meet our needs as young people, so that even as we take over in the decision making, we'll be able to allow other young people to take part just as we have been allowed to take part and fully involved. And this includes capacity building us in programming, planning, organizing, implementing, and even monitoring to ensure that every intervention, all the interventions that have been put in place are result oriented. So I'm just going to ask you a few questions. Just to repeat our panel discussion, it's the need for inclusive programming in the HIV response. So I'm going to ask this question, and I will give you just a minute each just to respond to this question. So what does inclusive programming in the HIV response mean to you? And what is your institution, or what are you doing to ensure that there is inclusive involvement of young people in the HIV response? Thank you.
Good afternoon. Good afternoon. I want to see the excitement as well. Thank you very much for this opportunity to share some of our experiences as CIDER's USID Checkup One project in terms of the inclusion of adolescents and young people in HIV programming. The key term here is inclusion. What do we mean by inclusion? And when we say inclusion, the other question that arises is including who? Those are the fundamental questions that we need to discuss as we are talking about inclusive programming. For every given program, there are always target population groups. So these target population groups could be adolescent girls and young women. It could be adolescent boys and young men. It could be the deaf. It could be the visually impaired. Those are the target groups depending on the nature of a particular program. In this case, when we talk about inclusive programming, we are basically saying the intended beneficiaries of a program should be treated as experts. Those are the ones who know what the problems are. Those are the ones who know what the solutions should be. That's what inclusive programming is all about. And by ensuring that the targeted audience or subpopulation groups are involved in the design, in the planning, in the implementation, as well as the monitoring and evaluation of the interventions. That's what brings about sustainable programming. So when we talk about inclusive programming, what does it help us achieve? One is that it ensures that the intended program then becomes demand driven. In other words, the intended population group will then drive access to services for that particular program. When we talk about inclusive programming, it then becomes needs-based. In other words, the intended beneficiaries are the best people to know what their needs are and how best those needs should be addressed. When we talk about inclusive programming, we are talking about a program being beneficiary responsive. A program can only be inclusive if it is beneficiary responsive. If it is addressing the issues for which that particular program is intended to achieve, specifically in relation to the target population group. And when we also talk about inclusive programming, it's also important to note that every targeted intervention needs to know what its audience is, or what who the beneficiaries should be. That's the only way we can achieve what you might call demand-driven programming, needs-based programming, and beneficiary responsive programming. Thank you.
Thank you so much. Good afternoon, everyone. RAHi, what do you say? RAHi. Nice. Great. Thank you. As you can see, I am deaf. I'm using hands to sign. So I don't know if you answered Kuchalo with a strong voice or not. I don't know. I'm deaf. But okay, thank you so much for having me. My name is Moses Soko. I'm the president of the Zambia Deaf Society. So speaking on behalf of the deaf, when we talk about inclusiveness, I believe it means to the deaf, it means access to information. So the more access to information is the key to us deaf people, especially persons with disabilities in general. You see, a lot of people say that a person with a disability, they call us people with disabilities, yes, but they are different disabilities. Others are visually impaired, others are on wheelchairs, others are deaf. We have different disabilities, but there is a way special. For us deaf people, our disability is special because we use hands to communicate. For other disabilities, they may be on wheelchair, they may be blind, but they can still hear, they can still access information. So you see the difference. For us deaf people, our disability is that we cannot access information. But for other disabilities, they can just sit even outside the hall. As long as they can hear the voice, they will have access to information. But to us deaf people, we can be in this room we are sitting, but if there's no sign language interpreter, then there's no inclusiveness for us. It means we are lost. So you find that we miss out in many ways. If there is no sign language for information to reach to us, then we miss out. For example, when you go to a health center, there is no confidentiality for a deaf person because the health workers, they do not know sign language. So in an environment where there is no information or there's no access to information, it will be difficult for me to go to a health center, even when I'm not feeling well. Especially if you are a man, you're just there with sickness on your own because of lack of information if you're a deaf man. So I think that is all I have to say, that to us, inclusivity means access to information. But I hope we'll have more time to interact later. I'll hand over to my colleague, Tina. Hello everyone. I want to see some energy. Are we sleeping or what? I'm very excited to see everyone here, coming from different parts of Zambia and outside Zambia. I'm very happy to see everyone. We hope that the information that you are going to benefit here, you are going to share with your colleagues when you go back. So I also want to share on the part of deaf women specifically when it comes to inclusiveness. The number one thing that we have to know that is very important, that for us as a community of the deaf women, as a community, we are tired. We've gone to workshop after workshop. We've tried to raise awareness about our needs, but there's nothing much that is being done. For example, when we talk about some of the health medicines like PrEP, you find that the Ministry of Health will have interventions. They'll go to different parts of Zambia. They'll have a megaphone. They will invite the people of the community. They will sensitize them about PrEP, how to protect themselves, how to take care of themselves, how about VCT, how to go for testing, ARVs. But a deaf person in that community will be around, but they will not have access to that information because probably the Minister of Health has not bothered to invite the deaf people in that community, or have not bothered to invite a deaf leader who would advise them where to identify deaf people in that community where they are going to raise awareness. So you find that they just go on their own without a sign language interpreter. So if they are sensitizing people about PrEP or health, and then there's no sign language interpreter, a deaf person will not get that information. So it is important, and I'm speaking to you colleagues, everyone in this room, in your respective organizations, when you are reaching out to the community, please always engage a sign language interpreter so that deaf people are also part of and parcel of the information that you are sharing. If it's a VCT, if it's about PrEP, if it's about condom use and so forth and so on. So as a result, because of not using sign language interpreters, a lot of deaf women are getting infected and they're just dying. Others are even getting raped or defiled. They don't even go anywhere to report, because why would they go to report without a sign language interpreter? So it's important that the sign language interpreter are included for deaf women to have access. Thank you.
Thank you so much. And my next question is, how are you as individuals, but also as the representative of the Zambia Deaf Society and CIDES, involving young people in your programmings in order to respond to the HIV response? Thank you.
Thank you very much for that important question. I'll talk about the number of programs that we are implementing as USID Checkup One project. How many of us are familiar with the DREAMS program? I want to see the hands of those that are familiar with the DREAMS program. So the DREAMS program is an initiative that is aimed at reducing the risk of HIV infection among adolescent girls and young women aged between 10 and 24. So in the DREAMS program, we implement a number of interventions. We have what we call social asset building activities, which are aimed at building, for instance, the self-esteem of adolescent girls and young women, familiarizing them with issues to do with sexual and gender-based violence. And also we provide biomedical services within the DREAM centers. In addition to that, there are also other interventions. I don't know how many of us had the opportunity of visiting the USID Checkup One booth. If you visited the booth, you'll discover that there are some of the economic strengthening initiatives that we are implementing. These include supporting young women start their own small businesses as a way of empowering them. It includes skills building or skills transfer so that the girls and the young women are empowered with the necessary survival skills, which helps reduce the risk of transactional sex simply because a young girl or a young woman wants to have access to money. And if you visited the DREAM centers, those DREAM centers are not run by men. They are not run by old women. Those DREAM centers are run by the young women themselves. They know the services, they know the needs, they know the challenges that the adolescents themselves, the young women themselves face. If you went in the DREAM Center, we have nurses that provide HIV counseling and testing. We have nurses that provide family planning services. We have nurses that provide PrEP. And those nurses are not old women. Those are young women that are able to freely engage with other young women who are in need of those services. In addition to that, we also implement, for instance, what we call the school-based HIV prevention program. This aims at targeting school-going kids with health education, with information on sexual and gender-based violence. And these initiatives are not implemented by old people. These are school-going kids that have been identified. These are school-going kids that have been trained to actually reach out to their fellow peers on all aspects of sexual and reproductive health. We also have economic strengthening activities. And these activities are driven by the adolescents and the young women themselves. Only last week, we were able, as a project, through the Dreams Initiative, to supply over 1,500 mama packs. This mama pack is a sanitary kit that comprises reusable diapers. It comprises reusable pads and also a tablet of soap. And those mama packs that we supplied were worth 30,000 US dollars. And this is the money that accrued to the adolescent girls and the young women themselves, because they are the ones who actually made those products. So those are some of the ways in which, as a project, we have empowered the adolescents and the young women themselves to take the lead in terms of the design of the interventions, the implementation of the interventions, as a way of empowering them to ensure that our response to HIV is sustainable. Thank you.
Thank you very much. That's a very important question. There are a lot of accessibility interventions that we are trying to do. Myself, I try to work with different organizations, but the most important part is raising awareness amongst the deaf. Unfortunately, we don't have so many deaf organizations to go around, So there are very few deaf-specific organizations. So as a result, you find that there are still a lot of gaps. For example, Moses Soko, the organization which is heading, I have my friend there, Rachel, also she's heading an organization. Rachel's organization, which is Youth Enabled Zambia, they have a program of distributing sanitary pads to school-going special needs children. Also, myself, I involve myself in reaching out specifically to school-going children in special education schools to give them information and education about comprehensive sex, HIV prevention, and so forth and so on. So, but there's still more that needs to be done for deaf people to be included. We really want to raise awareness amongst the deaf people themselves, first of all. Let us not generalize persons with disabilities, but specifically the deaf, because like my colleague mentioned, people with disabilities are in different categories. So others, they may have a disability, but they have a lot of information, but the deaf, they have very little information. So I'm targeting the deaf. I'll hand over to my big brother, Moses. Thank you so much. I just want to add on what has already been said. My organization, Zambia Deaf Society, has had a lot of activities here in Zambia, especially centered around health healthcare services. We are trying to make sure that deaf people have access to information and also receive good healthcare services. In 2020, we set up a TV program on Movie TV called Timveleni. We use that program to raise awareness about health care services for deaf people. Then in 2021, again, we received support. We received support where we traveled to southern and western provinces, where we interacted with deaf people there to raise awareness on health care services. And also teaching basic sign language skills to health workers. We had that project. So that when a deaf person visits a health center, at least a health worker will have some ways to communicate with a deaf person. Because a deaf person needs confidentiality. So it's better a health worker is able to sign on their own. And then they also understand the culture of deaf people. So we had that project in 2021 where we went to Southern Province and Western Province. Then again in 2022, we traveled to Central Province where we had the same project which we had in Southern Province, which is to raise awareness among the deaf themselves and teach basic sign language to health workers. And we did the same in Copper Belt. We are very thankful to UNAIDS. UNAIDS is one that has been supporting our projects to reach out to health workers to teach them basic signs and to reach out to deaf people to raise awareness about health. When we talk about teenage pregnancies, that is even a bigger problem in the deaf community. Why? Because, for example, a nurse, find that a nurse doesn't know how to communicate with a deaf person. So how will a deaf mother or a deaf adolescent go to the hospital to consult about contraceptive? Is it the loop in the arm? Is it the pill? Or is it in the uterus? How will the deaf woman communicate? You find that the deaf adolescent ends up getting wrong information and they're given wrong medication when they go to the hospital. So maybe the medication is supposed to be put in the arm. A deaf person they are consuming that medication orally, and then you find that they still end up pregnant. Why? Because there was miscommunication on health planning. So we believe as a deaf community that the biggest challenge is a cultural gap between the hearing people and the deaf. So we are trying to reach out to health workers, especially the nurses and doctors, to have some basic trainings that they just understand sign language and deaf culture. And that's what we did in Southern, Western Province, Central, and on the Copper Belt. So again, we still have a lot of work with the Minister of Health. We are working in collaboration with the Minister of Work and Maristop International. Maybe you can see there's a poster there, Maristop International at the back there. If you can see that poster, you can see their sign language pictures on that poster. So we are working with the health institutions like Maristops International, to create posters in sign language that deaf people can have access. Also, those can be put in hospitals and health centers. That a doctor can at least see a sign. How do you say sick or how do you say malaria? They can see some signs. And now a lot of health workers are interested and they are embracing learning basic sign language to communicate. So we had that project with Maristops here in Osaka, and now we are moving to the Copper Belt and Eastern Province. That's where we're going. So I'm asking all of you in this room, all the stakeholders, you are all stakeholders here. I ask you to support our program in every way when it comes to healthcare for deaf people. The number one key for deaf people is just communication. That's all. If there's communication, a deaf person will be able to receive healthcare services and get well. Also, yes, I understand there is need to sort of sign language interpreters. But when I go to the healthcare, I don't need an interpreter. I want to confidentiality. Why should my interpreter know that I'm HIV positive? Because when the health worker sees the results, the interpreter will hear face to say, "Oh, you are positive," and then the interpreter face to me. So I want confidentiality. I want the health worker to sign to me, so that we're able to communicate just the two of us. So we are trying to develop a curriculum in schools for health, for the nurses, health schools. Very soon you will see a curriculum that anyone who goes to study nursing, part of the subject that they'll be learning is Zambian Sign language. And probably you hear about me as the president of Zambia Deaf Society. I'm here. That's what we are spearheading.
Thank you so much. And in conclusion, this one is just for you, Doc. Can you please tell us the innovation that has been developed by CIDAS that is responding to the needs of young people in terms of HIV prevention? Thank you.
Thank you very much. Before I talk about the innovation, let me talk about the deaf. Last year we had a good experience and got a very good sense of the barriers and the challenges that the deaf face in terms of accessing health services. We had an opportunity of engaging the deaf at Munali School. We also had an opportunity of engaging the deaf at two schools in Matera. And we did this in collaboration with the Sign Language Association of Zambia. And that's an innovation that we are currently discussing in terms of taking that forward. Our plan is, as we get into the new year, starting October this year, is to have, as mentors working in the dream centers, our plan is to recruit some of the mentors from the deaf community as a way of reaching young adolescents and young women who are deaf. We've identified that as a gap in terms of reaching them with services. So our plan is to recruit some of the deaf young women as mentors so that they are able to reach to the fellow deaf adolescents and young women. In addition to that, we are also running a community HIV testing program. So we have peer promoters that reach out to their peers in the different communities with health education messages. We also have HTS counselors, HIV testing counselors. And our plan is, as we start the new year, to also work with the Sign Language Association of Zambia to identify some of the deaf people that we can bring on board on our project so that they work as peer promoters, so that they work as counselors. So those are some of the innovations that we've started bringing on board. And we know that as a project, as an organization, we can't do everything on our own. But through constructive engagement with the Sign Language Association of Zambia, we want to find better ways of ensuring that the programs that we are implementing are also responsive to the needs of deaf adolescents and young women. Then talking about the adolescents and young people in general, there's also an app that we are developing as a project, what we are calling My Space app, which will provide an opportunity for young people to virtually or remotely engage with healthcare providers on our project, for them to access information, for them to know where to get what services. And we believe that by capitalizing on the digital opportunities that are available, we should be able to reach as many adolescents and young people as possible. Thank you.
Thank you so much, Doc. Moses Soko, thank you so much. And Bettina, thank you so much. You can now take your seats. So a round of applause for our panelists. A round of applause. Igwe Kilo. With the energy. Igwe Kilo. So right about now, we're going to go into what we're calling breakout sessions. So you'll be taken to a specific group, and in that group, you'll be able to interact with the person or the people that will be leading that team, and you just follow the instructions of Madam Veronique Malupande, who just come through and give us specific instructions of where we're going to go. Thank you.
Thank you. So we don't want to take much time. We are going to sit where we're sitting. I'll ask this group, which is ending up to here, just turn your chair where you're seated, face this wall. Thank you. Well done. This group, so up to here, we're turning to that wall, up to here. Thank you. So I'm going to ask this whole group to join in there, and we are turning to that wall. Please, we don't have much time. I promise you, you'll have fun. Please lift your chair if you can. Thank you. We have people with OCD. Kindly lift your chair. This team here, face this way. Just move close and make sure you'll be able to hear what the presentation will be about. These chairs, I'm kindly asking for your help. Just, okay. Are you able to? So I'll ask that the interpreters probably go on the groups. I think we are 3, right? So these ones are facing this way. Yeah. And so you have to, oh, you come and, okay, are we good? Okay, so
Are we all divided in groups already?
so maybe I'll ask that it's this one. Yes. So may I ask that, will it be, I think this is okay. So we'll need to create a space here for people to, because if they do a second again, it's another proof for 10 minutes. Yeah.
So where
I only ask this. So I'm asking these guys to just come and carry your chair so we can fill up this space. We leave this space for someone who will make a presentation. They are coming in. You can even join. Yes, just.
Where are they?
Please, guys, can we hurry up and just move your chair? We create space in front.
So as we are in our groups, I believe our team members are already in their respective groups. So we are going to have 3 sessions in 3 groups like we have formed. So the first session is going to be more focused on the adolescent and young people HIV situation and response, faith-based. So in this group, we are going to have Zingo, the faith-based leaders, family development initiative. Then the second group, which is the second session, we're going to have, we'll be discussing about the adolescents and young people situation response traditional leaders. So in this group, we are going to have our parents, the traditional leaders, and the village heads. And last but not the least, in our third group, which is the third session, understanding treatment, HIV treatment needs for young people towards U2 equals U, which is the session 3. And in this group, we are going to have NZP plus, phenomenal youth, TAUC, ZNYP. I believe all that's clear, isn't it? So me and my co-chairs will be in either of the groups just to moderate the sessions and see how we can pick up the recommendations that we need out of these sessions.
Where's the second?
3, yeah? So understanding HIV treatment needs for young people towards U2 equals U. It is that group where Natasha is it? Great. The HIV, the adolescents and young people HIV situation and response, faith-based, where we'll have our faith-based leaders, family development initiative, and Zingo. It is that group there. And then we'll have group 2. Okay. I'm told for parents and traditional leaders, village head, it's there. The group 2 session is there, where it's written prevention is Bay. And group 1 is faith-based up at the end there. We'll have Zingo, the faith-based leaders, and family development initiatives. Young people, what I would encourage is let us have honest conversations in these sessions, because it is what we go through each and every day. Based on what they'll present, let us have those heated conversations. We pick out the solutions that we need. Let us critique. Let us give in our real life situations and see how best we can help each other. This is the core purpose of the Indaba. This is the meat. This is the job. Okay, I can see.
Right?
Okay.
Sir, because your presenter is going to be here. So
Quick.
this is not good for your discussion. Right. Okay. So here we are dealing with.
What session is taking place here?
So here we have organization.
Including Zingo?
Yes. Are you from Zingo?
We are the ones doing the
So,
Okay. So announce so that we know where to go. Faith-based organization. Faith-based. I would say you pastor. Any pastor.
Is this group here?
Are you a youth chairperson?
Okay, I know.
Youth pastor. You want to find out place.
What group is it?
What's the problem? Take it easy, take it easy. Don't be nervous. Don't shake. The thing is how the conversation is.
Yes. Everyone. Mama, you don't wait for your birthday. Can I have a sister? A sister who takes my number?
Yeah. So let me just here. So many for what do we do? Here.
1 2 1 2.
Volunteer.
just a small announcement to my colleagues moderating. We have about 3-4 minutes remaining towards the end of these breakout sessions that you're having. So I kindly advise that now we can get towards concluding our discussions. Thank you. Thank you. Thank you so much. Thank you so much. Thank you so much. At this point, my sincere appeal to all of you moderating is that please close the sessions now. Please close the sessions now. Okay. So, Okay, so we have very few announcements before we end the program. We have very few announcements, ladies and gentlemen. So, number one, first announcement is that if you've been attending the Indaba today and you haven't registered, we are kindly requesting upon you to register, because tomorrow you will not be allowed entry into the venue if you're not registered. I'll say that again. If you're not registered, please make sure you register, because tomorrow you will not be allowed entry into the venue if you are not registered. And also,
Hello, please do not go out. Do not go out yet, because there are few logistical announcements that are yet to be passed on. So please do not leave. Do not leave just now. Yeah, we have to know which bus is taking who and where. So please do not leave. Do not leave. We're waiting just for one of our colleagues to come and give us updates of how we are going to move and other logistical information. Thank you.
okay, so ladies and gentlemen, as we saw the executive director of the Zambian Youth Platform opening the program, and that is exactly what is going to happen even as we're going towards the close of the program. The executive director of Zambian Youth Platform is coming through to give closing remarks, so that we are given the freedom we are looking for. I'm aware, even I am tired. If you can tell, how my face is looking is not how I was looking in the morning. So I'm very, very tired, and I understand we are about to go home. Do we still have the energy to say RAHi? 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 So I have a secret, eh? The secret is that kuchiri something. I'm looking for a secret mumbone in person. Okay. Pressure takwab. So ladies and gentlemen, it's been an exciting day and interesting to see so many people participating and all the views that have been, elucidated in this place. It's been exciting seeing young people adding their voice to important matters. Persons with disabilities have also played their role in making sure that this event is successful. And so even as we are recognizing partners that have made this event possible, allow me to make mention of the Youth Advocates Zimbabwe, who've played a very pivotal role in making sure that our colleagues from Zimbabwe and Botswana are also a part of us. And this is an event that is going on all the way till Saturday. Tomorrow, we are also here at Mika Convention Center. Without further ado, ladies and gentlemen, allow me to invite the Executive Director of Zambian Youth Platform to come and give his closing remarks.
Are we happy? We look tired. You still want to dance? You sure? Okay, so I'm the one performing now. Where are my backup dancers? Okay, all right. Okay, so guys, thank you so much for today. You've been great. I hope you've all had fun. So the program continues tomorrow and Saturday. Just one announcement. May I get your attention, please? I'm seeing so many meetings in the audience. So one announcement with logistics. we have, firstly, we have overshot our numbers by over 100 people. So we have a lot of gate crashers in here. Thank you so much and congratulations for successfully crashing this event. You can clap for yourself. All the gate crashers. Yes, so you benefited from the tea, from the lunch. Congrats. Now there's another part that we can't be able to accommodate everyone who has crashed, which is logistics. So there are different groups in here. There are others supported by various partners who have been taken care of 100%. And there are some people that are local. They are coming and going back. So that's why we have the highest number of gate crashers. So because of that, we're not able to support anyone with transport refund today. The team needs to clean up the lists. So please, for those that successfully crashed today, excuse yourself tomorrow, okay? Please don't come tomorrow because I'm being very polite. Tomorrow, if you come, my team will not be able to support you in any way. And there's a chance you might not even have any meal. Not that they're being mean, but it's like we don't have enough money to support everyone that wants to be part of the event. And that's the reason why there's an online platform for people to participate easily. Okay, so if you want to be part of the event, please, you can follow online. Let's be together. And for those that are participating online, the team is taking note. And those are people that we prioritize to ensure that they're part of the event, the other upcoming events. So there'll be different rewards being given tomorrow. Everyone, especially those that are participating online, will be giving t-shirts, cups, and different things that will be given out throughout the day. So being online is not a disadvantage at all. You'll still be able to get everything that you want to get, except that you'll not be here physically. So I hope that you understand that. Okay, so the list will be cleaned up. So when you come, only those that have been invited officially will be allowed into the room. Because once you get into the room, we can't control who is having meals and who isn't. So I hope that is clear. So we should be able to pay transport refunds either tomorrow or on the last day on Saturday. All other logistics should be sorted out in that order. I hope that is clear. Unfortunately, we'll not be opening up for any questions. This is just an announcement and not a question and answer session. But if anything is unclear, you can contact any of the team members to get more information. All right, so I've just been reminded that there are other people here that did not register this morning. Please ensure that you register, because if you don't register, even if you're formally invited, if you are not registered, they'll be using the list from today as well to compare. So you're not registered, they'll take it you did not come. You are not here. So tomorrow you may just inconvenience yourself. And they don't want to be dealing with that drama we had outside earlier this morning. Okay, so make time, ensure that you register before you leave. So tomorrow we start on a good note. We lost so much time today and we're hoping to catch up tomorrow. Okay. And Tibre? All right, so I'll give Veronique an opportunity to just announce we have tea break from the morning. We didn't have tea. We're busy dancing with the minister and the artists. And we also have tea break from the afternoon. So we have quite a lot of food in the rooms across. So she will announce the order in which we're going to have access to this tea. Thank you so much, everyone.
So tomorrow, 7:30 for pickups. If you are coming here by bus, so it's 7:30, make sure that you get on a bus. It will courier you here. And Chamba Valley, may I see those that are going back to Chamba Valley? Okay, so may I ask that you don't do stampedes. Just walk nicely outside. I'll show you where you're getting your tea break because the bus is here. So for those that are going nearby, your bus is coming. Your bus is coming. So I'm only dealing with Chamba Valley people. I'll show you where to get your tea break.